we talked about how we know that burnout comes from the work environment. Our decades of research have told us that the sources of stress in the work environment will continue to lead to burnout and secondary traumatic stress for our clinicians. So if we just keep building personal resilience building, we're not going to get at what's important. We're not going to help our clinicians get better. So what can we do to help support decreasing burnout? That's the strategies that we're going to talk about here. The good news is all of those decades of research have also come up with evidence or recommendations to help support organizations implementing well-being for their employees. The recommendation that's most recent is the National Academy of Medicine. They've created a clinician well-being group, and in 2019, they put out a report called Taking Action Against Clinician Burnout, a Systems Approach to Professional Well-Being. And what's most significant about this report is that all of the recommendations were aimed at organizations and how the organizations can support clinician burnout. So in the reference link is the link to this report, and I encourage any leader or any clinician to read it to see if their organization is implementing these tactics. And we'll also be discussing some of these in the strategy examples that we're talking about today. One of the most important tactics in their 6 recommendations is creating a healthy work environment. And this is no surprise for anybody in the nursing field. We've been talking about healthy work environments for a very long time. So many organizations, especially magnet hospitals, the American Association of Critical Care Nurses, lots of organizations within nursing know that a healthy work environment is the key to helping nurses not get burned out. The good news is we know a lot about improving work environments and creating a healthy work environment. So we'll talk about what that means to create a healthy work environment, but then we'll also talk about what can nurse leaders do right now. It's really great that we have strategies for the whole organization, and we know a lot of organizations are adopting well-being into their strategic aims right now, but we also want to give recommendations for nurse leaders at the unit level right now. What can they do for their staff and for them to improve well-being? So we'll give ideas on how to reduce burnout, give appreciation, and address secondary trauma in their staff. So first, let's look at that healthy work environment. This is the model from the American Association of Critical Care Nurses. And again, there's other structures for what creates a healthy work environment. But if you look at them all and you kind of step back and say, what is a healthy work environment? Essentially, the pieces are the same. A healthy work environment has good communication, right? We can't have a work environment where people aren't communicating with each other. Also, in a healthy work environment, there's real collaboration, true collaboration. When we think about all the different professions within a clinical care environment, we have to have good collaboration between our teams, between our partners, between the different levels and professions within that environment. The other thing we want to see is effective decision making. Clinicians, providers, everyone wants to be able to make decisions and evaluate the care and the operations that they're doing at the level that's appropriate for them. When we're part of an organization that doesn't let us make decisions at our appropriate level, then it's not a healthy work environment. Most importantly, and I think everyone would agree, appropriate staffing. This is not only a hot topic, but a very significant topic. And what is really important to note here is that appropriate staffing is never just about the number. It's not just about the number of nurses, the number of staff. It's about the right type of staff, enough staff, and the right resources. And we'll talk a little bit more about that. And near and dear to my heart is meaningful recognition. When you're in a healthy work environment, you're recognized for the work that you do. And there are key components to this type of recognition. It's not just off the hand, a pizza party, or a one-off stop from your boss to say good job. Meaningful recognition means you're valued for the work that you do in a way that's meaningful to you. And then finally, leadership has to be some part of that environment, right? And so when you have authentic leadership who embraces that work environment and engages it, role models it, and supports the work of their staff, that's a healthy work environment. So again, many of these components are similar in whatever model you look at, but what we understand about a healthy work environment is that it's key to positive outcomes in other places. So key to outcomes for good staff, good care, retention of nurses, and also decreased burnout. So we know, and the NAM has also recognized, the National Academy of Medicine has also recognized, that a healthy work environment is a key strategic initiative to improving outcomes. So I'm going to give a couple recommendations again on that strategic way that we look at building that culture of well-being, but then also what can that nurse leader do now? How can we improve that unit level work right now? And so on the top part here, I want to reiterate what it means to have a healthy work environment when it comes to staffing. Staffing is that key everyone wants to talk about. We couldn't give this presentation if we didn't acknowledge staffing, right? And so it's about enough staff, but is it enough staff to maintain patient safety, and not just about the numbers, but also the right mix of staff and the support services available? So if we add more nurses, are we not just taking away all of the support staff, the housekeepers, the people that answer phones? That's just as not effective as not having the right number of nurses. So when we look at what's involved when it comes to a healthy work environment and staffing, we definitely do not want to take our eyes off the prize. The long-term goal is having a good staffing plan with all of these key components listed to the top. And what does that mean? That means shared governance is involved in the decision making. Nurse leaders are part of leading this process, and that we're looking at the holistic picture, that it's about the nurses, the type of nurses, and then we're looking at the pieces that are involved in creating that healthy work environment. So the acuity of our patients, the resources that we have, and then a huge issue that's also identified related to burnout is our electronic health record and the documentation burden. If we bring in enough staffing, but we still have these additional burdens that are leading to our burnout, we're not looking at the whole picture. So, as I mentioned, eyes on the prize, staffing is definitely the issue that we want to address, not only related to patient safety, a healthy work environment, clinical outcomes, but also including burnout and clinician well-being as part of the holistic picture of understanding good staffing. Now, when we think about well-being and the nurse leader and what could be done right now, what's the recommendation? What recommendation could we have for immediately? And to that, I would say breaks. We must be persistent and non-negotiable in how we do breaks for our staff. And I'm talking about more than just our 15-minute break and our lunch break. Go back to the definition of burnout and that key component of what is breaking our staff right now: emotional and physical exhaustion. And so when we think about our immediate need for a break, we're talking about something maybe as simple as minutes. Minutes needed when something happens and a nurse or a healthcare worker needs to stop and pause and acknowledge the situation. If we're not even allowing for that moment, those minutes of breaks, then obviously it will lead to emotional and physical exhaustion. So evaluate the situation and say, during this stressful event, during this high burden situation, how am I staffing to allow for an immediate pause, a post-code event pause, an in-between patient discharge pause, the chance for a nurse to not break with physical and emotional exhaustion and have that break. And that might be the minutes. Then think about those 15-minute and those 30-minute lunch breaks and the emotional and physical exhaustion. Is the break room a mess? Is there no space for a break room? Is there no place for a pause? You've heard of these relaxation rooms. These are chances to look holistically at breaks and say, am I allowing for decompression? Am I allowing for a chance for someone to get away from the emotional and physical exhaustion and say, take this break, take this mental well-being break? That's the simple break. And then even take a step back further and know when a crisis happens, when an event happens, When the unexpected happens and one of our staff isn't doing well, are the HR policies set up? Is my team set up in a way where I can say, this happened and this shouldn't have happened to you today. You need to go home. Can I have the staff that covers you today? That's the next level too. Am I holistic enough in saying I can send this person home? Or even the next level step. Think about when something goes wrong in another work setting and a person needs to take a leave of absence or a sabbatical. Sabbatical is not even a word we use in nursing, right? And so these are the longer term goals of thinking about how breaks can help us retain our nurses and get them away from having that emotional and physical exhaustion. And these are actions that our nurse leaders can take on our units and start having these conversations in addressing burnout related to staffing.